Hello, I'm Mariana from Federal University of Espírito Santo. The other authors was Cândida Primo, Thaís Brito, Raquel Santana, Lisley Dias, and Carolina Brancato. Our research is breastfeeding and Down syndrome. Breastfeeding is a dynamic interaction process in which mother and child interact with each other and with the environment to achieve the benefits of human health, of human milk offered direct from the breast to the child, being a unique experience in each event. And the Ministry of Health said, Brazilian Ministry of Health said people have recommend exclusive breastfeeding in the first 6 months of life and complemented up to at least 2 years of age. And the United Nations Children Fund said that only 39% of children under 6 months are exclusively breastfed. Our objective is to investigate the experience of mothers in the relation to breastfeeding babies with Down syndrome. This is a descriptive study. The data collection is a semi-structured interview, and we have 3 parts: socioeconomic issues of the mother, questions about pregnancy, questions about the experience of breastfeeding a baby with trisomy 21. The inclusion criteria is legal guardians of children with T21 who are up to 5 years of age at the time of the interview. This group of mother was part a Victoria Down Association. This is a Brazilian association in the Espírito Santo. Sorry. Methodology. The analysis stem proposed by Minayo. The research was approved in the Ethics Committee of Center of Health Science of Federal University of Espírito Santo by this number in 219. The participants are 10 mothers that was interviewed. These mothers lives in Vitória, Espírito Santo. Their age was 32 and 43 years. Their age are between 32 and 43 years. 9 declared to be married or in a stable union, and 1 declared to be single. Six women had completed higher education, 3 reported complete higher school, and 1 reported have completed only elementary school. Now you can, Carol.
All the interviews were divided in these thematic units: the diagnosis of the 21 baby and the desire to breastfeed, the breastfeeding familiar and friends support that the mother has, the role of the health institutional professionals, the influence of health mother conditions, and the influence of the baby biological conditions. As the results and discussion, we can talk about each of these themes. The diagnosis of the 21 baby and the desire to breastfeed. Considering breastfeed as one of the most important forms and interactions of strengthening the bond between the mother and child binomial, it is essential to highlight that this event demands the desire and the decision, among other alternatives, to breastfeed their babies. When asked if the desire to breastfeed changed in relation to the feeling they had during the pregnancy and after the birth of the baby with trisomy 21, most of the mothers stated that no, because knowing about the trisomy became a motivation to breastfeed. Talking about the diagnosis to the baby also, some of the declaration of the mother were no, on the contrary. That was when I really wanted to, because I knew that my milk was even more important to the baby. Another mother said that, quite the contrary, I think that the desire to breastfeed, it increased because I already know the benefit it has. The fact that he has Down syndrome only sharpened the desire to breastfeed him. On the other hand, we also noticed that one of the participant mothers stated that she had no desire to breastfeed. However, because she understood breastfeeding as a basic need for her baby, she decided to do so. She said, I had no desire, but I know it was going to do it because I need to do it. But it was nothing that cool or all the fantasy she was thinking about. I thought it was something that could be dispensed, which is part of the motherhood that I didn't want. Talking about the influence of the baby, the biological conditions of the baby, the macroglossia and the lingual protrusion and global hypotonia were affecting. The congenital heart diseases, complete or incomplete defect of the atrioventricular septum, atrial or ventricular septal defects, and tetralogy of Fallot. There are also babies who even present alterations related to the syndrome when starting the interaction to breastfeeding. They were able to do it in a fluid and satisfactory way. The mother was saying he was able to breastfeed straight away. He positioned his tongue right, and he was very good. It was a wonderful moment. I cried a lot, and she was so emotional. Considering the influence of the maternal health conditions, we can mention the breast anatomy, the milk production, and the emotional conditions. Some of the appointments were, he didn't want to get my breast because I didn't have a nipple. Another mother said she couldn't make the nipple handle because my nipple was flat. Then it made it difficult for her to catch. Another mother said only colostrum came out and then nothing else. They tried to put me in the pump to see if the milk comes, but without success. Talking about the role of the health institution and professionals, we can say that professional actions carried out with the binomial in these first hours with the objective of assisting and establishing early breastfeeding are necessary to address the various aspects of that support in this moment and provide a positive outcome breastfeeding assistance. Some of the appointments were saying I was very well guided by both pediatrician who accompanied him and his breastfeeding speech pathologist. For this reason, we were able to move on. Another mother said I was very well orientated by the nurse at the hospital. They were patient and very willing to help me. I also had a very well service at the milk bank. All the staff welcomed me and offered me emotional support. Another mother said the speech pathology and a young nurse were kindly orienting me and the milk bank. The milk bank was a pivoting point for me. They offered me all support and affection I needed at the moment. I was feeling so empowered by them. Talking on another theme that was the role of the health professional, we also can say that in the same topic, we can also say that on the other hand were experienced in where this interaction was not as positive. They are also experiencing which institutions and health professionals involved in this process did not offer adequate support, generating insecurity and another demotivation feelings and becoming negative influence factors in breastfeeding. Talking about the breastfeeding familiar and friend support that the mother has out of the hospital, we can mention that satisfactory support from family and friends and other trust people were very important. The lack of support and social network also has a great influence, and support networks against breastfeeding also was noticed in some examples. people who were saying that it was not necessary and was disencouraged that with the moms. Some of the appointments said, I had unconditional support from my husband, so it was a positive experience. Another mom said, my husband always supported and encouraged a lot of breastfeeding. The friends too, mothers who had already been through this experience helped me a lot. So the support of peers as well, it happens as an important factor. It was, another mother said, I was on my own without support. So a loneliness here in this deployment. Another mother said, every time I tried to breastfeed, my husband was unsupportive. He encouraged me to offer formula. Many other people in the family say the same to me. I had no support, neither by the doctor. So negative experience. So as a conclusion of analyzing all these aspects, we can say that after analyzing the report, it is possible to observe how each woman experienced during breastfeeding a baby with trisomy 21. And it's possible to understand that despite the characteristics inherent to the trisomy 21, the baby is able to breastfeed if properly stimulated. Women, when they decide to breastfeed, are able to offer the breast, providing the proper support. They have also proven that inadequate professional care can give a negative determinant in this powerful and at the same time delicate process. As a support network to the binomial, specifically when it comes to the partner and close family members with great influence who become discouraging features. When the 10 mothers interviewed had in common was the fact that they were at some point feeling very welcomed by the Victoria Down Association. And in addition, each lived a completely different story within this vast team. These are some of the references we used for this work. We would like to thank very much for this opportunity. And here are the contacts of Dr. Mariana. And thank you very much.
Thank you. Bye.